shoulder and arm and which kind of nerves will be damaged at this point. So when we will be looking at shoulder and arms position, there are multiple nerves that will be injured here. So shoulder dislocation is most common. It is anterior-inferior dislocation, and nerve damage here is will be axillary nerve. Artery is posterior circumflex humeral artery damage will be there when anterior-inferior dislocation of shoulder happens. Axillary nerve and posterior circumflex humeral artery. When there is midshaft fracture, there will be radial nerve and profunda brachial artery damage at the mid shaft of humerus. Radial nerve will be damaged here. Another, when there is supracondylar region fracture, median nerve will be damaged and brachial artery will be damaged here. If there is medial epicondyle damage, there will be ulnar nerve damage of the medial epicondyle region of humerus. Another one is foramen forearm fracture. When there is proximal ulna anterior dislocation of radial head will be there, then it will be Montegui fracture, and Gilazzi fracture will be distal radius plus subluxation of ulna at wrist. Okay, so next is wrist and hand injuries includes Colles fracture and Smith fracture. When there is posterior displacement of radius, which is dinner fork deformity, Colles fracture is posterior and Smith fracture is anterior dislocation of radius. I will be looking, I will showing you the images of both of these fractures like Colles fracture and Smith fracture. When there is a scaphoid fracture, most commonly is carpal bone risk will be carpal bone, and lunate dislocation is dislocated carpal may compress median nerve. Okay, so let me show you some images related to these fractures. Okay, so here is Colles fracture and Smith fracture. In Colles fracture, we studied that there will be posterior dislocation of radius, posterior dislocation in Colles fracture, and a dinner fork deformity. Now, in Smith fracture, there is anterior dislocation. Now, here you can see here radius is posterior, and in Smith fracture, there is the anterior dislocation and inward deviation of radius. This is the difference between Colles and Smith fracture. Okay, so this one is close up of Colles fracture and Smith fracture. In Colles fracture, there is posterior dislocation here in this image. We can see the posterior dislocation, and in Smith fracture, this is anterior dislocation. So in this way, radius is dislocated anteriorly. Colles and Smith fracture presents in this way. Now here, as we can see, there is fracture which involve Colles fracture and radial fracture at the distal